Good afternoon. My name is Ioana Creanga-Murariu, and my PhD is about cannabinoids in the landscape of cancer. I'm an oncology resident, and my vision is to improve quality of life for cancer patients, and the mission is to decrease disease burden in cancer patients. For this year, I have 3 specific goals. The first is to investigate the safety and efficacy of cannabinoids in cancer patients. As cancer incidence is increasing, the mortality seems to be decreasing, so quality of life is as important as an efficient therapy. The most prevalent symptoms for cancer burden are fatigue, pain, and lack of appetite. Almost 30% of cancer patients admit using cannabinoids for these symptoms, either physician prescribed or illicitly procured. However, they raise some issues regarding the proper therapy indication and safety. So our question is, are cannabinoids safe and more efficient by comparison to standard of care or placebo for the palliation of cancer-related symptoms? We are going to investigate cancer patients that are administered cannabinoids compared to standard of care or placebo, and we will assess the efficacy, tolerability, and safety. Our clinical implication is that we will have a new palliative drug and improved quality of life. We conducted a systematic search in 3 databases using a combination between cancer and cannabinoid domain, and in the end we got 98 eligible articles. As you can see, we have some outcomes, but we finished only the side effects. Now I will present you some preliminary outcomes. The first is pain, assessed in case of advanced cancer patients that were experiencing this despite a maximal opioid therapy. Pain was measured using different rating scales, with 0 meaning no symptom and the largest value meaning the worst pain intensity. These results come from 4 randomized controlled trials. In the first 3, patients receive a combination between THC and CBD, and in the last, the patients received a CBD-based drug and were compared to placebo. Our results show that cannabinoids do not clinically improve pain, clinically relevant improve pain. The second outcome is constipation, measured in advanced cancer patients that were experiencing this as a side effect from their opioid therapy. It was measured on the numerical rating scale, with 0 meaning no symptom and 10 meaning complete obstruction. Here you can see results from 3 randomized controlled trials where patients receive a drug based on THC plus CBD and were compared to placebo. And again, we did not find any clinically relevant symptom improvement. The third outcome is insomnia for advanced cancer patients, measured on the same numerical rating scale, with 0 meaning best sleep and 10 meaning complete insomnia. And again, we did not find any clinically relevant insomnia improvement. I'm moving on to some side effects of cannabinoids. The most interesting results are for the psychiatric side events. We included events like hallucinations, delusion, paranoia, psychosis, nightmares, anxiety, and mood swings. Very interesting is that patients that were using THC-based drugs had 10 times higher chance of having a psychiatric side event. However, patients using THC plus CBD drugs had the odds of psychiatric side events of 2.6. We assessed multiple other side effects. Only asthenia and gastrointestinal side effects were statistically relevant. One limitation of our study is that we could not group the side effects based on the intensity grading system. However, the articles provided information about how many patients stopped the cannabinoid treatment due to increased toxicity. Our results show that THC users had 3 times higher chance of abandoning the cannabinoid treatment as opposed to THC plus CBD users, which had an odds of 1.3. Our study assesses multiple outcomes and has done a comprehensive analysis of every type of cannabinoid. We have limitation because we included interventional and observational studies with high risk of bias, increased heterogeneity due to the intervention itself, and do not forget that these are patient-reported outcomes. Based on our preliminary analysis, we can say that cannabinoids are not an effective option for the palliation of cancer-associated symptoms. So they should not be prescribed for pain, constipation, or insomnia due to lack of effect. THC-based drugs should be carefully prescribed due to the increased risk of psychiatric side effects. THC plus CBD and CBD-based drugs have a good safety profile. The implication for research is that we need more studies assessing the health effects of cannabinoid with a high content of CBD. Right now, we are in the manuscript writing phase. The second project is investigating the antitumor activity of cannabinoids in preclinical models. Alternative treatment options for cancer are always developing. Sometimes repurposing drugs with other indications is a cheaper strategy. The antitumor effects of cannabinoids were demonstrated in preclinical studies and investigated in various cancer models. They can induct apoptosis and autophagy. They have anti-angiogenetic properties and can decrease invasion and metastasis. So our clinical question is whether cannabinoids have antitumor activity compared to controls in preclinical tumor models. We are going to investigate in vitro and in vivo tumor models that are administered cannabinoids with or without chemotherapy, and we will compare them to controls without cannabinoids or chemotherapy, and we will assess the antitumor effect, which means decrease in tumor cells or volume. The research implication is that we will have a new anti-cancer drug and decrease in cancer-associated mortality. After we did the selection, we ended with 230 eligible full text articles, and now we are almost done with data extraction. And finally, my third project is investigating the profile of cannabinoid use among cancer patients. Cannabinoids are gaining popularity for symptom control among cancer patients. Almost 40% of them admit using, given the legalization and decriminalization policies. Do not forget that the global market size for the cannabinoid is more than $13 billion. However, medical cannabis and other cannabinoids than dronabinol and nabilon are still not FDA approved. So for this project, we have two question frameworks. The first is what are the characteristics of cancer patients consuming cannabinoids, and we will investigate their age, employment status, education, the cancer type, stage, other comorbidities, the prescriptor, either if it's physician prescribed or self-prescribed. And the second is what are the particularities of cannabinoid administration in cancer patients. And we will assess the indication, the type of cannabinoid, the route of administration, and the form. Our hypothesis is that cannabinoid use is dependent on the patient demographics, and choosing the type of cannabinoid is highly dependent on the form and mode of administration. The clinical implication is that we can prescribe drugs according to the patient's preference, design future studies which support the patient's needs, and regulate the use of cannabinoids based on the patient's needs. We found several articles with the same question framework, which ensures that our project is feasible, and we did not find any meta-analysis on the topic. So in summary, I have three projects. The first is about the safety and efficacy of cannabinoids for symptom control. The second is about their anti-tumor activity in preclinical models. And the third is the profile of cannabis use among cancer patients. Thank you, and do not forget, the harder you work, the more luck you seem to have.
This presentation, I would like to ask you, how can I prescribe cannabinoids for patients? Where can he buy it? Pharmacy? What kind of medicine available?
Right now, the oncology guidelines allow us to prescribe only two types of cannabinoids, dronabinol and nabilon. The only indication for that is chemotherapy-associated nausea and vomiting. As far as I know, in Hungary, it is not allowed to use them. However, in the Western Europe, it is used. But it is only used as a second-line treatment, not first line.
Thank you very much. Any questions?
Thank you.
How was the pain assessed in these studies?
Using questionnaires, symptom rating questionnaires. The assessors ask the patient, how much pain do you feel at the beginning and after the intervention was administered.
In a 10-grade scale or something?
These data use two types of questionnaires. The first is 0 to 10, and the second is 0 to 100. So basically, dividing the second, we get the same.
So, you know, CBD is very popular everywhere, and there are a lot of unpharmaceutical preparations available on the market. And are there any effective substance in that, or because they are quite expensive? So there's nothing like just peanuts or something?
Well, actually, we don't really know, because I think you could see in supermarkets you can buy CBD-based products which are sold as supplementary medications. Not all of them have the research behind that. We will assess only the published research in our project, and you will see for our next progress report the data based on the actual evidence.
Was there anything at all that THC or CBD made better in these patients? Because you told about the important medical outcomes, but was there anything which was better for the patients?
Yeah.
Anything which could not be meta-analyzed, but the studies suggested that they had a more relaxed time. I mean, getting a little bit of THC can be fun.
We actually have more outcomes, and we have analyzed more articles, which I did not present today because they needed some corrections. But altogether, we could find some improvement in pain, but in observational studies. I'm looking forward for my next plots about anxiety, depression, anorexia, and chemotherapy-induced nausea and vomiting. I hope we will have interesting results there.
I think I have almost the same question. Yeah. Like, what is your implication based on your results?
What do I feel about the drugs?
The practice implication.
Well,
what would you do different in the clinics?
I think I should wait for more research. Even though they are popular and a lot of patients use cannabinoids in illicit way, and there is a lot of popular belief and media attention to it, I feel like we need more studies assessing the efficacy, because the effects of cannabinoids could vary based on their formulation, based on their route of administration, based on their dosage. And we could not analyze that based on the existing research right now. So maybe future studies need to, be more careful about these pharmacokinetic properties of cannabinoids.
All right. My second question regarding the second project, what do you think is the mechanism of action of cannabinoids in terms of anti-tumor effect?
Well, I'm proud to say that I did this type of preclinical research in our lab, and we actually found out that in a breast cancer model of mouse, cannabinoids decrease the tumor volume by inducing apoptosis. So based on our research, we can say that apoptosis was the mechanism. Based on other researchers, there is mentioning of the anti-angiogenetic properties, decreased invasion and metastasis. So I think our meta-analysis will give more clear information on this also.
Right, thank you.